Hi, I'm Dr. Jeffrey Annamarino. In the past, we've talked about menopause and some of the effects that we're seeing with women that have been presenting in our office. We launched a menopause platform in 2022, and now we're really happy to see that it's starting to gain some ground and some discussion on social media and some of the other specialties kind of picking up which what we hoped it would do. And so with this chatter that's been going on, they're really discussing some of the symptoms that women are having with menopause. So there's a lot of information coming out now about diet and exercise, lifting weights, bone health, hormone therapy. So dispelling a lot of the old myths that were circling around menopause, and I think we're bringing it into the new era, and it's really exciting to see. We still have a lot of patients coming into the office with some of the effects that we're seeing, despite the diet, the exercise, even some semaglutides that are helping with women, but we're still seeing that distribution of fat in areas they didn't have it before. That's the biggest complaint. Women are saying, I'm not gaining any weight, but even though I'm dieting and exercising, I'm still getting some fatty tissue in areas I never had it. My pants don't fit right. One of the biggest areas we're seeing is the top of the abdominal wall, just under the ribs. Also along the bra line. So this is something that we've been seeing now for the last couple of years, where it just seems to be more and more prominent, where that area around the upper back has become more thickened. And so women are really having an issue with this because when they have their bras on, it's very uncomfortable and it causes some rolls. So in certain clothing, it really is very noticeable. So those are those kind of areas. Also changes in their breasts, whether they're losing volume and seeing some sagging. Some women actually gain some volume in their breasts. What we've been able to do in the office is basically reinvent what we do with liposuction with these patients. So we talk about targeted areas of liposuction. Sometimes we do it in the operating room, and depending upon how many areas I need to address. The other option that we have now is Lipo AI. It's a laser lipo device that I've been using in my office for about 3 years now. So more targeted areas like the upper back, the bra line, upper abdominal wall, arms we've had terrific success with. So these are the areas that women are complaining about most. When we do it in the office, it's an hour to an hour and a half. There's no anesthesia. There's some oral sedation and some Pronox if needed, but there's really no anesthesia, nothing to really recover from, and you're back to work within days, back to exercise within a week. So we've had terrific success with that. The other areas would be a breast lift or maybe a breast reduction. Sometimes, patients are getting some loss of the fatty tissue with the diet and exercise, and they're gaining back like extra skin. So sometimes we have to go to the operating room and cut that skin away. The menopause is really starting to become a household term, and people are talking about it in positive ways, which is always good. I think if you're having any of these issues, talk to your gynecologist, your primary care. If you're having any issues with what I've just discussed, with some extra fatty tissue, clothing, your body habit is changing a little bit, I'm happy to talk to you, examine you, and kind of go over what some options would be. Some of them maybe even non-surgical.